A lot of comments coming from people on Instagram really concerned about low AMH, particularly when it comes to potential fertility treatment outcomes. Could you describe or explain what AMH actually is and what it means?
Yeah. So it stands for anti-Müllerian hormone, and it's a blood test, and it basically gives a reflection of your egg reserve. So as we know that as women, we are born with all of the eggs that we will ever have. Again, context is important. You have the most number of eggs when you're like a 4-month-old fetus, and it drops then significantly by the time that you're born, and again by the time that you go into puberty, and then again, by the time you're in your sort of 30s, and then it starts to take a more steep decline between, say, 35 to 37. And by the time that you hit the menopause, you have maybe a couple of thousand sort of immature eggs remaining. The AMH test is a good test at reflecting your egg reserve. But I sometimes even take issue with it being called a fertility test, because if a fertility test is a test of how likely you are to get pregnant, well, it doesn't do that. It has a purpose in terms of giving you an idea of the egg reserve, but it doesn't tell you about your chance of getting pregnant naturally, spontaneously. So, it's a problem that it's marketed in that way, because having a high AMH doesn't reassure you that you will be able to get pregnant with ease, and having a low AMH doesn't mean that you and sometimes people with PCOS have a very high AMH, and again, having a low AMH doesn't mean. I've seen people with undetectable AMHs who have gotten pregnant, spontaneously or naturally. I started having a look online and searching to see what was out there, and within like 5 minutes of looking up like AMH, I was bombarded with videos about how to boost your AMH, and these various teas that you could drink, and these exercises you could do. And I was watching them thinking like, this biologically doesn't even make any sense. And so the fact that this is something that people are so desperately wanting, and then that is also then being coupled with like clever marketing tactics, makes people very vulnerable, very perceptible to this kind of thing. And I think probably that brings us quite neatly onto things like AMH testing and sperm testing. I actually would say, some of if you do an at-home sperm test and it's normal, then probably that's okay. But if you find an issue, then that's very valuable information, because as I say, if you now need to move straight towards IVF or ICSI, then you don't really want to be spending 12 months trying without that information. Whereas the AMH doesn't give you the same kind of doesn't steer you in the same way. So it's a problem, and it's a problem because a lot of these companies um have seen an opportunity to make money. And I'm not saying it's not the same for every company. There are lots of really different ones, and there are ones that have, different kind of ethos. And but number one, you need to actually check the test is validated. They're not even all validated. And then beyond that, how is this result going to be delivered to you? Is there like is there somebody who's trained in this, who has even just a basic understanding of the science, that is going to explain to you what this means with context? Because a lot of people are getting text messages or emails um, with no further support, and it just creates a bigger problem than you had to start with.
Yeah. I mean, that's terrifying, because I can imagine there are a lot of women out there who are potentially taking photos of that email or sending a picture of it to ChatGPT to try and get it explained, which is,
Yeah, that's very true, actually. Um, yeah, now a lot of the time you almost feel like there's three of you in a consultation. It's like you, the patient, and the internet.
yeah. And I laugh about it and I ridicule it, but I also do it myself, because,
We all
you
do.
know, it's it's quite reassuring as well, isn't
Yeah,
it?
yeah,
Scarily
yeah,
so. So, in
yeah.
response to the listener who said, I've had an at home AMH test and it's low, am I infertile? What would you say?
No, it's not, because as I say, it's not a test of your fertility. And unfortunately, there actually is no, the only test of fertility is trying to get pregnant. And that's
Yeah.
the reality. We can look at the important thing to say is that AMH only tells you about your egg quantity or the reserve. It doesn't tell you about egg quality, which is far more important for your chances of getting pregnant. Whether that's trying to get pregnant actually, or if that's trying to get pregnant in the context of fertility treatment. And that's really where it's the most useful, because um, when you're looking at somebody with a high AMH, then you might be thinking that you're going to get a high proportion of eggs from one retrieval, and it's then helping you to decide, well, what dose of medication am I going to give this person, and how many cycles are they likely to need, and that helps with your counseling. It doesn't tell you if you are going to get pregnant naturally or not. There is no test for that, which is difficult.
It is. It is. Am I right in thinking that even though you can't improve your egg quantity or increase your egg quantity, you can improve your egg quality and your sperm quality?
You're right in saying that you can't increase your egg quantity, because it's biologically implausible, because you're born with all of the eggs that you're ever going to make. So there's no way to increase them. Then in terms of improving your egg quality, I mean, it's not so straightforward. We know the biggest determinant of egg quality is age. And of course, there's nothing that we can do about our age, but there are some things that we can control, like definitely avoiding things like smoking and binge drinking, because that does harm egg quality and increases things like risk of miscarriage. I spoke earlier about there is some evidence around some supplements, like for example CoQ10 in women with a lower reserve who are going through fertility treatment, but there isn't like a magic supplements that is going to boost your egg quality in that sense.
If you enjoyed that little snippet, there is more where that came from. Just head to the show notes below and you'll find the link to the full episode. Enjoy!